one question I think is an interesting one is when we ask people how do osteopaths help? So how do you guys reduce pain? Actually, same with chiropractors. I think people know the general idea, but actually if you were to ask, what does it actually do? Not a lot of people can actually put their finger on it. And one thing I wanted to show you is if we look at this diagram here, if we're looking at we're looking at the nerve root coming out from the spine.
Yep.
We've got the ventral ramus and the dorsal ramus. And on that dorsal ramus, so the one that's going backwards, we're going to have a medial and lateral branch. So that medial branch, you know, when neurosurgeons do like a nerve block.
Yes.
That's what they're doing, right? Because the medial branch supplies that facet. But if you look at all that muscle, so we've got all those intrinsics and then we've got all those extrinsics, the nerves are passing through them. So when we're talking about those nerve compressions earlier and this development of chronic pain, if we have a scenario where the intrinsics aren't stabilizing the spine very well,
yeah,
and now the extrinsics are being recruited to help, or we have chronic stress, so that now we're increasing muscle tone all the time, we start to compress these peripheral nerves as they go through muscle. And so that's where you're palpating a patient's back and they're saying, ow, it's really tender. Or frankly, a patient lies on the bench and you can see their rectus spinae standing out off the bench. You know it's going to hurt when you touch it. It hurts because these nerves have become super sensitized. So when we do our adjustments, I think part of what's happening is as we stretch those muscles and we have that relaxation associated with it, you decompress those nerves. Other things that we can use for that, vibration is quite a nice one. So vibration is going to improve that proprioception. Now the research on vibration shows that it's short-term benefits. Not many long-term studies to say that it has, that it has long-term changes, but it's a nice one to use in your clinic where you can, let's say you're so sensitive I can't touch you very much. Vibration sense should go through the proprioceptive pathways, so it should be painless. Now, if these are all very sensitive, it can hurt. So, but when we're doing it with patients, you shouldn't be using vibration thinking, I'm going to like push this down onto your back and loosen up these muscles. We want to use vibration and get the speed up nice and high and use it as a proprioceptive input.
What do you use for that?
I have a thing. I have a thing.
And it's great that I've asked you a question and the name goes straight out of your head.
Yeah.
We use a thumper in my clinic, which is it's quite a nice massage kit.
Yeah.
With little lumpy bits that actually go up and down rather than rotate.
I used to work in a clinic that had a thumper. It's a good machine, and the one I have now is just a single head. The speed isn't as important as you think. The important bit is that the patient feels it as vibration. So like you said, the lumpy kind of rolly ones, that's not going to have the same effect,
right?
Because it's not activating the same pathways. So we want to do vibration because we want to really kind of activate those proprioceptive pathways. When we're asking Grace to balance, if she has really bad balance in back pain, it's because we're losing that proprioception because all those intrinsic and extrinsics are just hypertonic. Yeah. We talked about laser, and that might be a good option now because you can see how these nerves, they start very deep, right? But they're coming up into these very peripheral areas. Now, I haven't got a diagram for you today because I didn't want to overwhelm us with too many diagrams, but these are giving sensation to the skin. So what you can't see in this diagram is all these little branches poking through the skin. Yeah. So I think part of the reason that things like low-level laser work is you're hitting these peripheral afferents, desensitizing them. Yes. And then giving you a window in. So I would often do laser first before doing an adjustment.